Hello, my name is Giji Alex, and I'm going to do a comprehensive physical assessment of Miss Tina Jones, who has come to the clinic for a pre-employment physical examination. So, Miss Tina Jones is in the clinic, so let us start by greeting her. Hello, Miss Jones. My name is Giji Alex, and I am here to do your physical assessment today.
Hey.
All right, so let's start with the physical assessment. Let's start with the head and neck assessment. So let's first check the vital signs of Miss Tina Jones. Her vital signs have been recorded, which all seems to be within normal limits. Next, let us go and inspect her head. So inspecting her head looks like her head looks normocephalic with no trauma, visible trauma. Next, let us go and do her inspect her eyes. Let's inspect her right eye and her left eye, and her bilateral eyes look good with equal hair distribution on the lashes and eyebrows. Lids without lesions, no ptosis or edema noted. All right, so next let us inspect Tina's mouth and throat. First, let us depress her tongue. Okay, then let's pull up the tongue. Then the tongue to the left, tongue to the right. And lastly, let us check for her gag reflex. Okay, so Miss Tina Jones' throat looks pink. There is no abnormalities noted. It is moist without any ulceration or lesions. The uvula rises midline on phonation, and her gag reflex is intact. Next, let us inspect her eyelids. Let's do the right eyelids first. Lower eyelid of both the right and the left. Yes, okay. So both the eyelids, they look good with good hair distribution. The conjunctiva looks pink. There's no lesions. The sclera is white, and perla is bilateral. All right, let's next inspect her ears. Okay, that is the right ear, which looks okay from externally. No abnormalities noted externally. Okay, let's move on to palpate Tina's scalp. Okay. All right, the scalp is palpated. There's no masses or any bumps felt on the scalp. Next, let us palpate her cervical lymph nodes. First, let us palpate the upper cervical lymph nodes down to her neck. And no masses, no palpable lymph nodes are felt on the cervical lymph nodes. Next, let us palpate the supraclavicular lymph nodes. And similarly, there is no palpable nodes on the supraclavicular lymph nodes. Okay, next let us palpate Tina's thyroid. All right, so the thyroid is smooth without any nodules and no goiter. Next, let us palpate the TMJ. So we will ask Tina to open and close her mouth. All right, palpate the jaws and there's no clicks and it has full range of motion. Next, let us palpate her sinuses. Let's start with the frontal sinuses. No pain or tenderness noted in the frontal sinuses. The lower or the maxillary sinuses next. And there's no pain or tenderness noted on the maxillary sinus. Next, let us palpate her axillary lymph nodes. There's no palpable nodes in the bilateral axillary lymph nodes. Okay, next let us use the pen light to check her eyes. So let's start with the right eye. Let's turn the light on and turn it off, and you can see the normal reaction to the light. The light reflex is normal. Let's test the left pupillary light reflex. Turn on the light. And it's a normal pupillary light reflex on the left side too. Next, let us check her eyes using the ophthalmoscope. Let's start with the right eye. And looking at the fundus, as we go around, we see the optic disc and we see the cotton ball look, which is seen in retinopathic changes of the eye. And that was the examination, ophthalmoscopic examination of the right eye. Now let us do the examination of the left eye. All right, let's go look at the fundus. And we see the optic disc. It looks pretty normal. I do not see no cotton ball appearances. Okay, so that the right eye does have retinopathic changes, but the left eye looks normal through the ophthalmoscope. Next, let us use the otoscope to check her ears and the nose. Let's start with the nose. The right nostril, it looks pink and moist, no drainage. The left nostril too looks pink, moist, and no drainage. Next, let us examine her left ear. The left ear too looks normal. There's no wax. The cone of light is at 7 o'clock, and the tympanic membrane is pearly gray in color. Next, let us look at the right ear. Here we can see that there's no drainage, no cerebrum seen. The cone of light is at 5 o'clock, and the tympanic membrane is pearly gray in color. So that's normal finding. Next, let us assess the eye movements. So we will tell Tina to follow the fingers with just her eyes.
Okay.
Okay, so convergence of the eyes is checked with the eye movements, and it's normal. The extraocular movements are all normal. Next, let us check her visual acuity. So first, let us tell her to cover her left eye and tell her to read.
FP TOZ LPED PECFD EDFCZP FELOPZD DEFPOTEC. I can't read that line. It's too little.
All right. So the next, you will cover your right eye. And let's start reading.
FP TOZ LPED PECFD EDFCZP FELOPZD. DEFPOTEC. I can't read that line. It's too little.
All right. So we check the visual acuity of both her eyes, and both her eyes have 20/20 vision, which is good. Next, let us check the assess for the peripheral vision. So I'm going to tell Tina to tell when she can no longer see my fingers.
Okay, I will. Now.
Okay. So peripheral vision is tested, which is normal. Next, you're going to check her ears for the whisper test. We'll start with the right ear.
F. F. 8. 8. W. W.
All right, let's do her left ear. So we close the right ear.
4. 4. R. R. 9. 9.
All right, so whisper test is done of the right and the left ear, which is normal. Her hearing is intact. Next, let us start with the abdominal assessment. First, let us inspect her abdomen. So we see that Tina's abdomen is protuberant. There is some striae, but there are no other scars. And we do see hair growth from the umbilicus right down to the pubis. Next, let us palpate her abdomen, starting with the light palpation. So let's palpate the 4 quadrants. Start with the upper right quadrant. It is soft with no masses. Then let us palpate the right lower quadrant, which is also soft with no masses. Let's move on to the left side. So the left upper quadrant is also soft with no masses. And the left lower quadrant is also soft with no masses felt. So that was good. Next, let us palpate for the organs in the abdomen. Let's palpate for the liver. So the liver is palpable 1 centimeter below the right costal margin, which is normal. Next, let us palpate for the right kidney. The right kidney is not palpable and there is no masses felt. Next, let us palpate on the left side for the spleen. The spleen is not palpable. And the last, let us palpate for the left kidney, which is not palpable and no masses are felt. Next, let us do the deep palpation of the abdomen. Let's start with the right upper quadrant. With deep pressure, there is no masses felt in the upper quadrant. On the lower left quadrant, there is palpated and there's no masses are felt too. And on the left upper quadrant, palpated with no masses felt, and the left lower quadrant also palpated with no masses felt. So that was a normal deep palpation assessment of the abdomen. Next, let us percuss the liver span. So the liver span is percussed, which is 7 centimeters mid-clavicular line on percussion, and it is tympanic on percussion throughout. Let's assess the CVA tenderness. There is no CVA tenderness on the right, and on the left too there is no CVA tenderness seen. Next, let us percuss the rest of the abdomen. Let's start with the right upper quadrant. It's tympanic on percussion. The right lower quadrant is also tympanic on percussion. The left anterior axillary line is, the spleen is percussed and there is no dullness felt. The left upper quadrant is tympanic on percussion, and the left lower quadrant is tympanic on percussion. Next, let us auscultate the abdomen. So let's auscultate the 4 quadrants. Let's start with the auscultation of the right upper quadrant, right lower quadrant, the left upper quadrant, and the left lower quadrant. Okay, so the bowel sounds in the 4 quadrants of the abdomen are normoactive. That was the abdominal assessment. Next, let us move on to the cardiovascular assessment. Let us start with inspecting the legs for edema. So both the right and the left leg is inspected and there is no edema noted. Next let us palpate the peripheral pulses in the upper arm. Let's start with the right side. So the right brachial artery is palpated, which is 2 plus. The right radial pulse is palpated, which is 2 plus. The left brachial pulse is palpated, which is 2 plus. And the left radial pulse is palpated, which is also 2 plus. So that's good. Next, let us palpate the PMI. So palpated the anterior chest, the PMI is non-displaced. There are no heaves and no lifts, which is really good. Next, let us palpate the peripheral pulses in the lower extremities. So the right femoral pulse is 2 plus. Let's move on to the right tibial pulse, which is 2 plus, and the right dorsalis pedis pulse, which is 2 plus. Let us also go to the left side and check the left dorsalis pedis pulse, which is 2 plus. Let us check the left tibial pulse, which is also 2 plus. Then, since the patient is lying down, let us check the left femoral pulse, which is also 2 plus. And then let us, since she has to change her position, let us check for the bilateral popliteal pulses. So the left popliteal pulse is 2 plus, and the right popliteal pulse is also 2 plus. So her peripheral pulses are normal. Next, let us palpate the carotids. So palpation of the right carotid. Her pulses are 2 plus and there is no thrill. And the left carotid is also 2 plus and there is no thrill. That is normal. And the next of the cardiac assessment is auscultating the carotids. Let's auscultate the right carotid. And there is no bruit auscultated. Let's auscultate the left carotid, which is also with no bruit. That is normal. So there's good flow of blood through the carotid arteries. Next, let us auscultate the abdominal arteries. Let us start by auscultating the aorta, which has no bruit. Let's auscultate the right renal artery, which has no bruit. The right iliac artery, which has no bruit. The right femoral artery, with no bruit. The left renal artery, with no bruit. The left iliac artery, with no bruit. And the left femoral artery, also with no bruit. Next, let us auscultate the cardiac points. Let us start with the aortic area. And flip to the diaphragm. Okay. Then let us auscultate the pulmonic area. Flip to the bell. Next, let us auscultate the Erb's point. let us auscultate the tricuspid area. And finally, auscultate the mitral area. All right. So the cardiac assessment is normal with the S1 and S2 without murmurs, no gallops, no rubs. It's a normal heart sounds. Next, let us assess the capillary refill of the fingers. Let's start with the right hand and the right pinky finger. The right ring finger. The right middle finger. And the right index finger. Okay, let's move on to the left hand, the left pinky finger, the left ring finger, the left middle finger, and the left index finger. So the capillary refill of bilateral fingers of both hands are 3 plus, which is normal. Sorry, which is less than 3 seconds, which is normal. Next, let us assess the capillary refill of the toes. Let us start with the right pinky toe. The middle toe, the right index toe, and the right big toe. Then let's move on to the left toes, the left pinky toe, the left ring toe, the left middle toe, the left index toe, and the left big toe. So we see that the capillary refill for the toes, both the left and the right toe, is less than 3 seconds, which is normal. Let's move on to the respiratory assessment. First, let us start with inspection. Let us inspect the posterior chest, which looks symmetrical, no abnormalities noted. Let's move on to inspect the anterior chest. Which is also symmetrical and with normal respirations. Next, let us palpate for tactile fremitus posteriorly. Let's check the upper back fremitus,
99,
the middle back
99,
fremitus, and the lower
99,
back fremitus. So the fremitus is equal bilaterally in the upper, middle, and the lower posterior chest wall. Next, let us palpate for symmetrical expansion posteriorly. Posterior thoracic expansion is symmetrical. Next, let us palpate for tactile fremitus anteriorly. The upper chest fremitus,
99,
the lower chest
99,
fremitus. The fremitus is equal bilaterally in the upper and lower anterior chest wall. Next, let us percuss the posterior chest. The right upper chest wall is resonant. The left upper chest wall is also resonant. The left middle posterior chest wall is resonant. The right middle posterior chest wall is resonant. The left lower posterior chest wall is resonant. The right lower posterior chest wall is also resonant. And these are also the lower posterior chest wall, which is all resonant to percussion. Next, let us percuss the anterior chest. Start with the right. The right upper anterior chest wall is resonant. The left anterior chest wall is resonant. The right middle anterior chest wall is resonant. The left middle anterior chest wall is resonant. The right lower anterior chest wall is resonant. And the left lower anterior chest wall is resonant. So the anterior chest wall is resonant throughout, which is normal. Next, let us auscultate the chest. So let us first just auscultate normally. Right middle anterior chest wall. That is the left middle anterior chest wall. That's the right lower anterior chest wall. And the left lower anterior chest wall. Okay. We're auscultating the voice sounds. That's the left lower chest
99,
wall. That's the right lower anterior lungs, the voice sounds. right middle lungs,
normal,
the left middle anterior lungs,
normal, normal,
the right upper anterior lungs,
normal,
99.
and the left upper anterior
normal,
lungs. So the voice sounds are normal and the breath sounds are equal bilaterally. No adventitious sounds and no rails, no wheezing, no cough, and no other abnormal sounds are heard. Now let's auscultate the posterior chest. First, let us auscultate the left upper anterior chest wall. Right posterior chest wall. The middle left posterior chest wall. Middle right posterior chest wall. The lower left posterior chest wall. And that's the lower right posterior chest wall. So now let us go on to check the voice sounds in the posterior chest.
normal, 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 normal,
It's the
normal,
lower left posterior lungs
normal,
and the lower right posterior lungs.
normal, 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 normal,
Okay, so auscultation of the posterior chest wall showed that the breath sounds are equal and symmetrical bilaterally, and there is no wheezing, no cough, no other adventitious sounds. So it's a normal examination of the breath sounds. Next, let us check for the use of the spirometer. Since Tina has a history of asthma, it would be necessary to check her spirometry readings. So we will ask Tina to blow into this spirometer. So her FVC is 1.78 and FEV1 is 1.549 liters. So that would give us a value of 87%. 87%, which would be a really normal lung function or lung capacity. Next, let us move on to the neurological examination of Tina. First, let us assess her motor skills from heel to shin. So I'm going to ask Tina to run a foot down the opposite shin. So to check for any cerebellar diseases. So first I'm going to tell her to run her right foot down her shin.
Sure.
So that was tested, which was a normal test. And now let us ask her to run her left foot down her shin.
Okay.
That was tested and it was normal. So the motor skill is normal. Next, I'm going to test the motor skills of finger to nose movements. So I'm going to tell Tina to close her eyes and touch her fingers to her nose.
I can do that.
So she was able to do that. So it's a normal motor skill of the upper extremity. Next I'm going to assess her orientation. So I'm going to ask her if she's oriented to herself. So I'm going to ask her what is her name and date of birth.
My name is Tina Jones, and I was born on February 17th.
Okay, next I'm going to see if she's oriented to the place. I'm going to ask her what building she is in.
I'm at the doctor's office. It's Shadow Health General Clinic.
That's great. And next I'm going to ask her if she's oriented to the time.
Today's date is.
Okay, so she is oriented times 4 to herself, to the place, to time, and to her surroundings. So oriented times 4. Next, I'm going to assess the motor skills of her hand movements. So I'm going to tell Tina to place her hands on her knees and turn them over.
Okay, like this?
So that was good. The rapid alternating hand movements was normal. Next, I'm going to tell her I'm going to assess her lower pain and light touch response. So I'm going to assess her legs for the sensations, which would be a sharp, dull, or soft touch. So I'm going to tell her to close her eyes and sense those sensations.
Okay.
Okay, so we'll start with the sensation of the legs. So the right leg
Dull.
proximal, then right leg distal,
Dull.
left leg proximal,
Dull.
and left leg distal.
Dull.
Okay, let's go on to the next sensation. To the right leg
Sharp.
proximal, right leg distal,
Sharp.
left leg proximal,
Sharp.
and left leg distal.
Sharp.
Okay, let's move on to the next sensation.
Soft.
Right leg proximal, then right leg distal,
Soft.
left leg proximal,
Soft.
and left leg distal.
Soft.
Good. So that was the sensations of her lower extremities, which was normal. Next, let us move on to assess the upper pain light touch response of her upper extremities. So I'm going to tell her to close her eyes and tell the sensation of whether the touch is sharp, dull, or soft.
Okay.
So let's do the right arm proximal,
Dull. Dull.
left arm proximal,
Dull.
left arm distal.
Dull.
Okay, let's move to the chest. Let's move to the sensations. Let's do right arm proximal,
Sharp.
right arm distal,
Sharp.
left arm proximal,
Sharp.
and left arm distal.
Sharp.
Back to the sensations. Right arm proximal,
Soft.
right arm distal,
Soft.
left arm proximal,
Soft.
left arm distal,
Soft.
and finally let's do the chest.
Soft.
Okay, let's do the sensations of on the chest.
Dull. Sharp.
Good. So all the sensory sensations are tested on the upper extremities and the chest. That is normal. Next, let us assess the position sense of the toes. So the position sense can indicate damage to the bone, spinal cord, or the nervous system disorder like multiple sclerosis. So I'm going to tell Tina to close her eyes and say if her toe moves up or down.
Okay,
Let's start with the right foot.
I think that was up.
And the left foot.
Down.
Okay, the position sense of the toes was tested, which was normal, within normal limits. Next, let us assess the position sense of the fingers. So a lack of position sense can indicate damage to the brainstem, spinal cord, or a nervous system disorder like multiple sclerosis. So I'm going to tell Tina to close her eyes and move her fingers up or down, okay?
Okay, I will.
Let's start with the left hand.
Up.
Right hand.
Down.
The position sense of the fingers are tested, which is normal. Next, let us do the monofilament test. So this test is to check for peripheral neuropathy, and we're using a microfilament to touch her feet and to see her response to that touch. So I'm going to tell her to close her eyes and tell if when she can feel the touch.
Okay, I will.
Let's start with the left foot.
Yes.
Right foot.
Yes. Yes.
Okay, so the monofilament test of the right and the left foot was done and the sensation was checked. It was noted that there is decreased sensation, especially of the plantar surfaces of the foot bilaterally, which could be an indication of peripheral neuropathy, and that could be because of her uncontrolled diabetes before she started her treatment. Next, let us test for deep tendon reflexes of the upper extremity. The right tricep reflex, deep tendon reflexes of the right tricep is 2 plus. The DTR of the right biceps is 2 plus. And the DTR of the right brachioradialis is 2 plus. To the left side, the DTR of the left triceps is 2 plus. The DTR of the left biceps is 2 plus. the DTR of the left brachioradialis is 2 plus. So the bilateral deep tendon reflexes of the upper extremities are all normal, and it's 2 plus. Next, let us test the deep tendon reflexes of the lower extremities. The right patella reflex, the DTR of the right knee is 2 plus. The deep tendon reflexes of the right ankle is 2 plus. The deep tendon reflexes of the left ankle is 2 plus. And then let us move on to the left knee. The left patellar reflex of the left knee is also 2 plus. So the deep tendon reflexes of the lower extremities are 2 plus, and which is normal. Next, let us test for the grapisthesia test. So grapisthesia is the ability to identify a number or letter that is traced on the skin of the hands, and if the patient is able to identify the number or the letter. So if they're not able to identify it, it is an indication of damage to the sensory cortex of the parietal lobe, damage to the spinal cord, or Alzheimer's disease. So I'm going to tell Tina to close her eyes and tell me what I trace on her palm.
Okay.
So the left hand,
That's an 8.
and the grapisthesia on the left hand is normal. She was able to identify the letter. And on the right hand,
A figure.
so the right hand grapisthesia by number identification is also normal. So that's a normal test. And then let us next go on to check the stereognosis test. So the stereognosis test shows the patient's ability to recognize common objects by cues like the texture, size, and shape. So this test is an indication, or if it's abnormal, it's an indication that the patient has a condition like Alzheimer's or lesions in the sensory cortex, the parietal lobe, or the posterior columns of the spinal cord. So I'm going to tell Tina to close her eyes and tell me what I put in her hand.
Okay, sure.
So the left hand,
That feels like a key. This is some wire thing. Paperclip? Some kind of coin.
okay. So the left hand stereognosis test is normal. She was able to identify all the objects. Now let's test the right hand.
That feels like a key.
Okay, the next one.
The paperclip again.
The last one.
Some kind of coin.
All right, so the right hand stereognosis test is normal. So bilateral, the right and the left hand stereognosis test is normal. She was able to identify the objects on both the hands. The next, let us move on. To check the knee strength. So I'm going to tell Tina that while I'm pushing lightly on her shins, she has to straighten her legs out all the way. So the right and the left knee strength is tested, which is 5 out of 5, which is normal. Next, we will assess the neck strength. So I'm going to tell her to turn her head right. I'm going to tell her that she's going to turn her head right, and I will resist her movement with my hand. Okay. I'm going to tell her to turn her head left, and I will resist her movement with my hand. I'm going to tell her to tilt her head to the right, and I will resist the movement with my hand. Okay. Then I'm going to tell her to tilt her head to the left, and I'm going to resist her movement with my hand. And then I'm going to tell her to tilt her head down, and she has to push her head down again, push against her forehead, and I want her to touch her chin to her chest. Okay, so all of the neck strength, the movements were done, and her neck strength is 5 out of 5, which is normal. Then I am going to assess her bicep strength. I'm going to check her, pull her forearms. So I'm going to tell her to curl her arms up. Okay, and then I'm going to tell her to push her forearms. So keeping her palms up, I'm going to tell her to straighten her arms out as I push back. All right, the bicep strength was tested. So the right and the left elbow strength is 5 out of 5, which is normal. Next, I am going to assess Tina's ankle strength. I'm going to tell her to point her toes like she's pushing a gas pedal. Then I will push back, and I want her to keep her toes pointed. Okay, the right and the left ankle strength is 5 out of 5. Next, I'm going to assess her hand strength. So I'm going to tilt her wrist up. So I'm going to tell her to keep her forearm straight and tilt her wrist up to the ceiling. I'm going to tell her to tilt her wrist down. So I'm going to tell her to keep her forearm straight and tilt her wrist down to the floor. And then the grasp fingers, I'm going to tell her with each hand to grasp my fingers and squeeze lightly. That's great. So the test for her right and her left hand strength is all 5 out of 5, which is normal. Then I'm going to assess her hip strength. I'm going to tell her that I'm going to resist her movement and she has to push her knees up toward the ceiling. Her right and her left hip strength is tested, which is 5 out of 5. Next, I'm going to assess her shoulder strength. I'm going to tell her that I'm going to push down on her shoulders. She would have to shrug her shoulders up against the resistance. So right and left shoulder strength is 5 out of 5. That's great. Next, I'm going to go into the rest of the musculoskeletal inspection or the assessment. Let's go into the range of motion assessment of the neck. So I'm going to do the extension of the neck. I'm going to tell her to tilt her head back and look toward the ceiling. Okay. Then I'm going to tell her to touch her shin to her chest. That's for the flexion. Okay. Then I'm going to tell her to touch her shoulders with her ears, both sides. Okay. And then I'm going to tell her to turn her head from side to side to check for the rotation. All right, great. So the range of motion of her neck is assessed. And which is all normal. Next, let me go on to assess the range of motion of her wrist. So I'm going to tell her check the range of motion of her wrist. So first, let's do the adduction and abduction. I'm going to tell her to turn her wrists to bring her fingers together and then apart. Okay. And then extension, I'm going to tell her to put her hands out, palms down, and point her fingers toward the ceiling. Okay. I'm going to tell her to put her hands out, palms down, and point her fingers towards the floor. That's great. So the range of motion of her fingers for adduction, abduction, extension, and flexion are all full range of motion. Okay, next let me check the range of motion of her ankles. I'm going to do the eversion and the inversion. So I'm going to tell her to rotate your left foot away from you so you can see the bottom outer edge of your foot. Then rotate it in toward you so you can see the bottom of your foot. So the same would be repeated with the right foot too. Okay. And then I'm going to check for the extension and flexion of the ankles. I'm going to tell her to point her toes towards the ceiling and then towards the floor. Good. So she has full range of motion for eversion, inversion, extension and flexion of her ankles, right and the left ankles. Next, I'm going to assess the range of motion of her spine. I'm going to tell her to bend back as far as she can. That's for the extension. For the flexion, I'm going to tell her to bend over and touch her toes. Great. Then for the lateral bending, I'm going to tell her to bend from her waist side to side. And then for rotation, I'm going to tell her to twist side to side from her waist. So she has full range of motion for extension, flexion, lateral bending, and rotation of her spine. Next, I'm going to assess the range of motion of her hips. First, let's do the abductor of the muscle of the hips. I'm going to tell her to move each leg out to the side. Next is the adductor muscles. I'm going to tell her to move her leg in under the opposite leg. That's great. Next is the extensor muscle. Lying on her stomach, she would have to lift her heels toward the ceiling. And the last would be the flexor muscle. So I'm going to tell her to lie on her back and lift her toes towards the ceiling. So that's great. She has a full range of motion of her abductor, adductor, extensor, and flexor muscles of her hips. Next, I'm going to assess the range of motion of her elbows, flexion and extension of the elbows. I'm going to tell her to bend her elbows, bend and then straighten her elbows. Okay, and then for supination and pronation, I'm going to tell her to turn her palms up to the ceiling, then down to the floor. Okay, so she has full range of motion of her flexion and extension and supination and pronation of her elbows. Next, I'm going to the range of motion of her shoulder. First, let us do the adduction. So I'm going to tell her to cross each arm in front of her body. Okay, next we'll check for the extension. I'm going to tell her to put her hands behind her back. Okay, then I'm going to test for the flexion. I'm going to tell her to raise her arms in front of her and overhead. So she has full range of motion for adduction, extension, and flexion of her shoulders. Next, I'm going to assess the range of motion of her knees. First, the extension. So I'm going to tell her to straighten her legs. And then for flexion, I'm going to tell her to raise each knee up to her chest. So she has, very good, she has full range of motion for extension and flexion of her knees, right and left knees. That brings us to the last system, that is the hair, nails, and skin. So let's start by inspecting her hair. So inspection of her hair reveals its normal hair growth. There's no area of baldness, and there is no infestation or no other abnormal findings of her hair. Next, let us inspect her toenails. So toenails inspected, which looks pink, and there is no ridges, no abnormalities, and it's a normal toenails. Next, let us inspect her fingernails. So all her fingernails look pink, and there's no ridges, no abnormalities, and they all look within normal limits. Last, let us inspect her skin. So the skin of her face. So we do see that she has scattered pustules like acne on her face, on her right side, and also on her left side. We also see that she has hair above her upper lip. There's hair growth above her upper lip. Next, let us inspect her neck. Let's look at the posterior area too of her neck. And let's go at the back, check her neck. Okay, so we do see that his darkened skin over her neck, around her neck, which is acanthosis nigricans, which is typical for patients with diabetes. And since she had uncontrolled diabetes at one point, it could have caused this. Next, let us inspect the skin over her abdomen, her arms. Okay, and then skin looks pretty normal. Then let's go to her lower body and inspect her knees. So bilateral knees, the skin looks normal. There's no abnormalities noted. Then let us go and look at her ankles. So her bilateral ankles. So her bilateral ankles look normal. The skin has no abnormalities noted. All right. So that brings us to the end of the head to foot assessment of Tina Jones. So that brings us to the end of the assessment, and we did note that her microfilament test of her foot showed that she had reduced sensations of her both her foot, which could be a sign of peripheral neuropathy. So she would have to follow up with the podiatrist, and otherwise her assessment is pretty normal, and she would be able to get approval for her pre-employment assessment to continue her job. Thank you so much.